Okay, so we are going to talk about proper testing. For the purpose of this video, I'm going to not be wearing my mask just because that way I can sound clearer. But just so you know, whenever you are testing or around patients, you should always 100% be wearing your N95 mask. Again, for the purpose of this video, I'm not wearing it only so that way I can be better understood. All right, so we are going to take our patient. We're going to call him over. Come on over. And there's one of two ways that we can pull them up for their system. I have Leah here is my assistant, and she has got our testing tablet. And so we can ask the patient their name or their date of birth. So what's your name?
Lori Martin.
Okay. And so she's going to look it up and find them in the system. Did you find them? Okay, perfect. So a lot of times when you're entering in the tablet, less is more, and it'll pull up. One of the other things, if they don't pull up right away, sometimes if they just barely registered, it may not come in the queue. You may have to just go back out, refresh, so that way their name can show up in it. If you have someone that is Spanish speaking or it's not clear, you can also just ask them for a copy of their ID, and you can find them based off what their ID is. But you can't start testing them until you have found them on the tablet. So then the next thing is we are going to establish why the patient is here. All right, Lori, thanks for coming today. Did you come to get a COVID test today?
I just came to get a COVID test because I was recently exposed by a family.
Okay, all right. So have you had any symptoms?
I don't think so, not really.
So you haven't had anything like a cough, sore throat, headache?
Yeah, my throat's been kind of sore.
Okay, so you'll notice that when initially asked if she had any symptoms, she said no, not really. But then when asked further, like a cough, sore throat, headache, she then actually did have symptoms. So that's something that you can't just ask a patient and expect them to give you all the information. A lot of times they will give you less, and so you kind of have to pry that information out of them. So as I'm getting this information over here, she's entering this in the tablet as far as their symptoms go. Okay, so you said that you've had sore throat. Have you had any coughs, any fevers?
I haven't been able to check my temp recently, but I have been feeling a little bit achy and chill.
And some body aches. We're also going to make sure to ask the patient their COVID history and their vaccination history. So, Lori, have you been vaccinated?
Yes, I have.
Okay, how many doses?
2 doses.
Okay, do you know what brand they were?
Moderna.
Okay, and have you had any history of COVID?
Yes, I have had COVID before.
Okay, when was that?
I think it was about middle of last year, around June or July.
Okay, perfect. So June, July of 2021.
Mm-hmm.
Perfect. And you're not pregnant or anything like that?
Mm-mm.
Okay. This is where you would go and fill out that information on the tablet. Some of those items are already listed there, but there are also additional risk factors that the patients are sometimes going to give. For example, if the patient is pregnant, in the additional risk factor field, you would put pregnant and how many weeks they are. You would put pregnant 27 weeks. For example, there's a patient that says, oh, well, yeah, I'm currently in chemotherapy. In that additional risk factor, you're going to go ahead and put chemotherapy, right? There's also a few review of systems that we are going to just naturally observe in what it is. We're going to make sure that the patient is alert and oriented. And what that means is she's able to sit here, she has a conversation, she's able to make eye contact with me, she is attentive and understands where she's at and what it is, that which is also affect, normal affect, which means she knows where she's at, she knows what conversation she is aware of what's going on, and also we want to just observe whether she's having labored breathing or non-labored breathing, and we can see that she is having normal breathing. It's not, that's where you'd say, okay, someone's having labored breathing. We do have patients that will be not alert and oriented, that they will be passed out, and like that we've had them pass out in line, where they're just too sick. And so those are things that we want to observe. It's not necessarily something that we're going to ask the patient. It is just something that we are going to observe in the patient as they're in your chair. Most of the time, all these things are going to be normal, but you will know when one of those things are outside of normal. And that is also something that if any of those things are outside of the normal, you will immediately get your provider that is either via telemedicine or on site to assess the patient. So, and then now we're going to go ahead and move on with doing the actual COVID testing. So we always want to let the patients know, we're going to want to explain to them what we are doing. So today we are going to do a nasal swab. It is going to go past into your sinus cavity. And so we're going to go a little bit deep. It's probably going to make your eyes water, but it'll be really quick and will be done quickly. So a couple things that you're going to want to do is you want to prep, you have your nasal swab, you have your test kit. We're gonna get this all ready and out open ahead of time. So we're gonna set that there, put that in the trash, and we've got our vial solution here. So then we're gonna have the patient, I'm gonna have you tilt your head back and pull your mask down, okay? And it's really important to have them tilt their head back, because when they tilt their head back, it's going to open up that passage and you're not going to find as much resistance. It's going to be more comfortable for the patient. So, and you're going to open up and you're going to take your test swab. What it's going to be, how it's going to feel is basically you're going to feel like you hit a wall and then you're going to go past it, okay? And if the patient starts squinting like this, they're going to block off that nasal passage, and so you're gonna have to say, I'm gonna need you to relax, I just have to get past that wall, okay? So we're gonna come in here. Olivia, if you can kind of zoom in what it is, and you just kind of hold back, and we're gonna take in, and you'll see wall, and then you gotta go past there and out, okay? And then you're gonna go ahead and hand them a tissue, because that eye is gonna water a little bit, all right? And now you've got this, and you're gonna take your test solution here, pull the lid off of that. And then you're gonna just mix it around here for about 10-15 seconds, okay? And then you'll be able to, your nasal thing in the trash. And now the kits do come with a top here. I don't use them, but you can if you want, and just put it on the top there to drip in the thing. I don't think it's really necessary. I just then pour it straight into my test strip at the bottom right there, and you'll see you'll fill up that little cap there. And then we're gonna wait for that to result. Now we still need to get all the patient's vitals. We've already got the patient's, why she's coming here, her symptoms, her risk factors, but now we're gonna go in and get the vitals. And we're gonna ask the patient, Lori, do you know how tall you are?
Yes, I'm 5'6".
Okay, and just so you know, a lot of patients, they won't necessarily know how tall they are. You can use your judgment on them, whether or not you want to have them stand up, take an estimate based off your own height. It doesn't need to be exact, but get as close of an estimate as they do. And as I'm doing all this information, she's been entering all this information as I'm having this conversation with the patient. Do you know your weight?
Yes, I weigh 125 pounds.
Okay, she's gonna enter that in. We do have scales at all of the sites that if they do not know their weight, you can just ask them to step up and go step on the scale. And then we're gonna go here. I'm gonna go ahead and take your blood pressure today, Lori. So what I'm gonna need you to do is your feet flat on the ground like this, and then have them sitting up, okay? And then we're gonna put on their wrist here. And the blood pressure cuff needs to be on the inside of the wrist. And you want nice and square and tight on there. And then you're gonna have them, you're gonna press start. You're gonna have them gently place it over their chest. And we want them to not talk while they're doing this, okay? And a lot of times they're gonna get real stiff and relaxed. And you're just gonna help them put that and just say, go ahead and relax. And take a deep breath. Now in the meantime, I'll take my pulse oximeter while that's running. And I will put it on their other finger, help them just relax. Now, I will tell you, some of the women have these really long nails and this pulse ox won't work on it. And on those ones, you will be able to get the heart rate from the blood pressure cuff. You just aren't gonna be able to get the O2 on those women with the really long nails. And that's just is gonna be okay. All right, and so also while that's going, I'm gonna get her temperature. 98.8. Her O2 is 97, and her heart rate is 74. Her blood pressure did not go through, so we're going to try this one more time. And that happens sometimes. It won't get a proper reading. You'll get an error or whatnot, and you're just gonna, run it again. Okay. Is it going? And it's perfect that we do the test beforehand, because the tests take a minute to process, and so that way it gives you time for that test to really have the good 2 or 3 minutes to run while you're getting all these vitals. Okay, so her blood pressure is 104/71, okay? And now we're gonna let Lori know today that she is negative, and we're gonna say, yay! So now, because you've had a known exposure in your household, if you do start to get a little bit more symptoms, go ahead and you can come back, and you can come back in 2 days and get it tested again. It may be that it's just too early that for your test to come back positive, and so, like I said, if you have more symptoms, come back in another 2 days. Now, we're going to talk about, there's a couple things that your negative letter is going to be going into your email, and she'll be able to access that, or in their portal. When they sign up now, they will have a portal that they're making that they can log in. Their letter will be accessible in their portal. Or if they need a paper, because sometimes they'll want a paper one, that's why we have these on the table here. You just need to fill out today's date, their name, their date of birth, and whether they're positive or negative, okay? And we have those both in English, and the Spanish ones are in the back, okay? But we do want to encourage the patients to know that their letters will be available if they log into their portal, okay? The other thing is when we are looking at the test results, if you come look here, Olivia. So you see here, this is the control line, and then there's a test line, okay? One line is negative, 2 lines is positive. Now, even if there was a very faint line on that second line, it would mean that that is positive. And so a lot of times, and so we'll kind of look and see, make sure there's no sign of a second line here. Now, if there was, a lot of times you want to use your judgment on with these resulting. If you have someone who is very symptomatic and basically it walks like a duck, talks like a duck, seems like, but yet it's coming out negative, maybe you're going to want to give that test a few more minutes to process, because sometimes that positive line will have a delayed reaction in coming up. So that's where, you're just going to have the patient sit and be like, you know what, it looks like it's going to be negative today, but we're going to just give that test a couple more minutes to process because you've had some symptoms. I just want to really make sure that it really is negative. But you have to remember, COVID is not the only thing that's out there. There are still colds, flus, everything else like that. So just because someone's sick does not mean it has to be COVID. But we do want to do our due diligence and just give it that little extra time to result if they are symptomatic. So I think that we would be safe at this point to say that, Lori, you were negative. We'll go ahead and have a nice day.
Thank you.
So now is what we're going to want to do is the patient's gone. We want to properly clean our entire station. So we're going to take our wipe, and we are going to wipe down the chair. We are going to wipe down our station here. We're going to throw out our test. We're going to wipe down our thermometer, our pulse ox on the inside, everything like that. We're going to wipe down the inside of our blood pressure cuff, okay? We're going to wipe down our pen because we wrote their letter, right? And our station, okay? And then we all set for the next patient. I also want to talk about when we need to get the provider involved. Remember, we're not just giving people COVID tests and sending them on their way. We are also doing a full review of systems and making sure that all of their vitals are normal. So with that being said, we have, every station should have this normal, or this vital cheat sheet. And this is gonna talk about, have a normal blood pressure range and abnormal. So this is the top number, that's the bottom number when they take the blood pressure. So depending on the age of the person, you're gonna see which one is, if they fall out of these parameters. Now, any patient that falls out of these parameters, you immediately need to get the provider on the phone, or bring the provider, if the provider's on site, bring the provider to the tent with the patient and let the provider know, hey, I've got a patient that has a blood pressure of 200 over 110. That's extremely high. We need to get the provider involved to discuss that with the patient. The oxygen levels, which this is where we get from our little O2 pulse ox here. If they're falling below 90%, again, we need to get that provider involved to discuss what that patient needs to do with that lower oxygen level. Body temperature, this is someone who's got a fever. This one isn't as important for you to immediately get the provider through, but we need to let the patient know that they have a fever, okay? And that they need to monitor that. Now, we will want to let the provider know, especially if they are positive for COVID. At that point, we'll want to get the provider involved and say, hey, they're positive for COVID and also have a fever right now. So that way the provider can just counsel them on managing that fever and it not getting too high. The other thing is for our heart rate, here's a cheat sheet for age range of what would be out of normal for a specific age. As you see, the younger that they are, a higher heart rate is normal for younger children. And as you get older, your heart rate would be at a lower normal range. So that way you have that quick cheat sheet. Again, any patients fall out of this, you immediately need to get the provider involved. All right?